My name is Joseph Chandy. I'm Director of Strategy and Delivery, focusing on primary care general practice. It's my privilege to present to you today our draft primary care commissioning and investment strategy. Next slide, please. So I think it's important to present what we're proposing as our vision. And it's very, very simple. It's for general practice, investing in our general practice. I think it's very important that this sits along our wider health system, and we already have an integrated caring system. And their vision is to bring together health, social care, and voluntary sector organisations to improve the health and well-being for the people of County Durham. So primarily, this strategy is to achieve the three main areas. We want to support the continued sustainability of primary care. In my next slide, I'll be talking about what the previous primary care strategy did, which was to strengthen general practice when it was in a crisis. I think we've achieved that, but we need to ensure primary care remains stable. For our patients, we want to deliver a more personalised, proactive, coordinated care. Though generally general practice is seen as a see and treat model, when patients fall poorly of any symptom description, they make a choice to come and see the GP practice. But actually we want to go further with the information we hold on our patients, especially frail, vulnerable and at-risk categories. We can actually proactively write to our patients and offer a more personalised care plan that would involve care at home or routine updates within the practice for their chronic conditions, and move into a more proactive delivery of general practice to stop people descending into more illness. Finally, general practice doesn't want to work as an island. We potentially want to do more and more closer to the patient's home. And I think COVID has demonstrated that for those patients who were already part of a hospital program of outpatients, now that hospitals are discouraging patients from turning up and would rather have their care closer to their home, I think this is an opportunity for general practice to step in and community care and provide through a collective of general practices that are known as primary care networks, more of that hospital-based delivery closer to the patient's home. Next slide, please. So we're refreshing the strategy because we feel that the current strategy has delivered on what we were aspiring to the last time round. And they're mainly around four key areas. Obviously, the most important thing to patients was about improved access into their GP surgery. I still get mixed views when I talk to patients. Some have very good access. Some sometimes still find their access to their GP practice challenging. But as a CCG, we've supported general practice to help change that mode of delivery. We supported general practice to extend to 7 days a week. How we did that was that we brought practices together, and they, as a collective, supported each other in opening till 8 o'clock on weeknights and every weekend, usually 9 till 1 or even longer in some parts of the county. This has been a great success and has meant an additional access over and above the normal surgery hours of 8 till 6, and this will continue. We work much more closely with our community colleagues who mainly support patients who need their care at home. And we have actually made great strides in integrating general practice and the community through a model we called Teams Around Patients, or TAPS for short. And they set up all over County Durham. And you'll now find that a lead GP in each area works with a lead community nurse, and together they coordinate their teams to give the best care and proactive care for our patients. And this we will be building on in the next coming years. A critical area for the last strategy was workforce, particularly GP workforce. As practices in County Durham were in a very challenging period previously. We developed a number of schemes, but especially I should mention the GP Career Start scheme, which has brought significant success and brought a significant number of GPs to County Durham who now remain in County Durham. And that, along with skills mixing, using advanced nurse practitioners and clinical practitioners in different ways in general practice, and other allied professionals, has meant that we have probably averted the crisis and turned the corner. We must sustain this. Practice nurses are critical to the delivery of primary care. We have a very successful Career Start practice nurse scheme. And the most important element is investment, because without money, it is impossible to achieve greater things for primary care. County Durham CCG have recognised the value general practice plays as part of the whole system. 90% of all contacts into the NHS come through general practice. So therefore, above the key core contract sum that a general practice receives, the CCG has topped this investment by 6.3 million per annum to date, to allow practices to do more and more services closer to the patient's home. And we intend to continue this investment approach. Next slide, please. So in the new strategy, what will be our priorities? First of all, we will continue to empower the patient. So how can we develop self-care so that patients feel more confident around a range of especially non-medical based interventions that will support their general health and well-being? Secondly, we have found through the COVID crisis that GPs had to find a different way of communicating with their patients, and the digital enabled that. And many patients now receive either telephone consultations or video consultations. We wish to expand on that offer, in addition to email consultations that's already also available. Broadening the team. So general practice believes that many of the conditions it sees on a day-to-day basis can be seen by other professionals if the practice could afford to employ these. We found the most cost-efficient way of doing that is between collectives of GP practices called primary care networks. There will be significant investment from the government over the next few years to allow these groups of practices to invest in new roles that will range from practice pharmacists, practice technicians, physiotherapists, social prescriber link workers, associate nurse consultants, to name a few. And how can care closer to home support general practice? This will be another key priority for us. How can our primary care networks develop more and more services that support patient care in their community? Next slide. How do we intend to deliver against these 4 priorities that I just mentioned? So supporting people to manage their own conditions. We have a range of initiatives now, and you may have encountered the work of the social prescriber link workers, who are now ringing patients, especially those that are vulnerable and frail, and supporting them with services that can come to their door and help them with their social care needs. We intend to expand that offering by developing health and wellbeing coaches for general practice and case care coordinators. We're going to develop our links with the voluntary sector. They are a significant resource in our communities and have a lot of strengths in what they can deliver that our traditional medical general practice model can't always deliver. So it's about creating a more holistic approach to support people managing their health conditions. And as I said already, the opportunities of becoming digitally enabled as general practice is significant. We do, and we will encourage general practice to be able to offer more and more on a digital platform. But we also need to consider the patients who perhaps don't have access to digital. And for those patients, the traditional access must be sustained for them. And in time, we should also develop opportunities so they're not necessarily digitally excluded. Broadening the range of healthcare professionals in primary care. Again, we will deliver this through a sustained plan. We will work with our primary care networks so they make the most of the recruitment opportunities to realise that investment and provide more services for their patients. We will also work with large-scale providers who are already employers of many of these professions, from paramedics to physiotherapists, and ensure that one sector does not rob another sector of its key personnel. So how can we work together so that there are enough professionals to go around the whole system? And the ongoing development of primary care networks that will be the glue around this. And how can they support service requirements? How important it is to sustain the early cancer diagnosis, especially at this time during COVID, when patients, for whatever reasons, are sometimes more reluctant to present with their symptoms. Mental health is very important, and I think we see this more during this time. So how can we support general practice to develop a model that gives a wider offering for their patient when they access them with mental health issues? And overall, how can we support pathways to develop our care closer to home model? Next slide, please. This slide just demonstrates the investment that we're making in general practice. In the large blue area, this shows the recurrent core investment that goes into general practice. And then the other slices of the pie shows all the top-up investment that we're making into general practice to support IT, diabetes, extended 7-day access, and primary care network investment. Next slide, please. So we do not want to finalize the strategy without having input from all stakeholders. The most important stakeholders are our patients, our public, recipients of this service. So what I've outlined, we ask 3 questions. Do you agree with our vision for building a better general practice? Are the 4 key priorities that we're focusing on, to you, the right areas of focus? Or do we need to be considering other areas as a higher priority? And is there, for you, anything that you feel should be included in the commissioning investment strategy that already isn't? We would like to gather your views and see whether there is a consensus on those views. And anything that is different from what we have in this strategy, we would then consider so that it informs the final version of this strategy. There are ways you can get in touch with us. There is an online survey via SurveyMonkey, or if you prefer a more personal touch, we have a special dedicated telephone number that you can ring so that one of our primary care team can talk you through your views. Our deadline so that we can collate your responses is the 24th of November. Thank you for listening. Please get in touch.